Collecting a saliva sample is a rather simple procedure. Saliva testing is an accurate analysis for hormone testing and adrenal function and is routinely used by thousands of practitioners throughout Australia. To ensure the accuracy of your test, please review the collection instructions that came with your collection pack. Be sure to take notes if you require. Firstly, identify when you plan on collecting the saliva sample. If you are a male, you can collect on any day of the month. If you are female, you will need to determine test collection days based on your menstrual cycle. For example, if you have a normal menstrual cycle, then you should collect on either day 19, 20, or 21, counting the first day of bleeding as day 1. If you have irregular or unpredictable menstrual cycles, you can collect any day that you are not bleeding. If you have some kind of cycle regularity, but not at the typical 28-day menstrual cycle lengths, you should follow these guidelines for collection. Long cycles, test at day 19 through 21, or from day 19 to 5 days prior to when the period is expected. For example, if the cycle is 35 days, collection can be done anytime between day 19 to day 30. Short cycles, collection should be done a couple of days prior to when bleeding starts. For example, someone with 14-day cycles should collect on day 12. Your physician may like to assess your hormone levels while you are currently taking hormone medication, such as progesterone. Therefore, if you are currently taking hormones, please refer to the blue table listed on page 1 of the instructions, or as instructed by your healthcare practitioner. To ensure an accurate collection process, wash your hands thoroughly with soap and dry with a clean towel prior to handling the kit contents. This will avoid any possible contamination. Next, lay out all the collection components on a clean surface table. If you have been provided with a collection kit that contains one saliva tube, more than likely you will be collecting for one of these tests. These tests require a sample collection within 30 minutes of rising from bed, or between 6 and 8 a.m. Unless you are collecting for code 1009, sleep profile, then collection will occur at 12 a.m. to 2 a.m. If you have been provided with a collection kit that contains 4 saliva tubes, you will most likely be collecting for one of these tests. If only one saliva tube collection kit has been provided, then print your first name, surname, date of birth, date of collection, and time of collection where it requires you to do so on the tube. Fasting overnight for at least 8 hours prior is recommended. After laying out the test tubes, wash your hands and dry again prior to sample collection. Rinse your mouth with cold water 10 minutes or so prior to collection. It is important not to eat or brush or floss before collection, as this may lead to sample contamination. Commence the collection process by allowing saliva to accumulate naturally in your mouth without swallowing. Try to avoid coughing phlegm or mucus, as this will be unacceptable for testing. Some simple tricks may be to suck the inside of your cheeks or think about your favorite sweet. Once saliva has accumulated, gently transfer this into the saliva tube. Collect saliva until the tube has reached to the neck of the tube. It is normal that this may take 30 minutes to do so. When completed, place the cap onto the tube tightly and into the specimen carrier bag. If you have been provided a 4-tube collection kit, then proceed with collecting a sample at 12 p.m., 4 p.m., and 8 p.m. following the same instructions for sample 1. Finally, cross-check your NutriPath request form against the sample details to ensure all patient demographics are the same. Indicate whether you are taking hormone medication, such as progesterone, or something else on the request form by simply ticking the box. Complete the NutriPath patient checklist form to ensure no delays in test results. Place the request form into the non-sealable section of the specimen transport bag. Place the specimen transport bag into the Express Reply paid envelope and seal. Sign the envelope to ensure overnight express, and then place it into the yellow express bin. Thank you for choosing NutriPath, and we hope this video has been helpful.